Welcome back to my YouTube video channel. I am presenting to you guys a case, an orthodontist case right now. How to manage the adult anterior crossbite and posterior teeth opening. As you can see, this case, we started with patient came in with sideway picture with posterior disclosed. All the back teeth here is opening, and only front teeth, two or three front teeth touching. On this side, you can see starting from lateral canine all the way back. Patient didn't have much of the occlusion, and upper arch seemed to be straight, lower arch seemed to be straight. But what's going on? Well, we came to find out that the patient did have braces but didn't wear retainer. So this is how it looked. It's in his early 30. How we're going to improve this. So this is how we come, and this is how we finish. So we put any kind of veneer and just adjust this and get the bite come on together. We started with the conventional orthodontist treatment, align all those teeth that is were being relapsed. We align everything and take time. We're able to pull the teeth together using class 3 elastic. Patient have to wear elastic in order to correct this type of disclusion. So patient compliance is the key. So you can see every time I just reinforce wearing elastic. This is how it's coming out. This is before, this is before, this is before, and this is after. Significant improve without surgery, any veneer or crown. Again, this is before and this is after. Before disclosure, now no disclosure. This was so much severe grinding going on. Patient is advised to wear the night guard at night time to continue reducing the grinding problem. But you can see on the right side, it were before they were disclosed. There's no intercuspation in the back posterior teeth up to the lateral here, but now there is evidence of contact. So I want to make sure I'm able to get back to my video. So 1 second, here we go. So you see after lot improving. Thank you for watching. This is before, this is after. If you have any question for this case quite simple. What you learn is with this type of appliance, you need to tell the patient to wear elastic, class 2 elastic. Without wearing class 3 elastic, we can't accomplish this. And I want to thank you again for allowing me to present this presentation. If you guys have any questions, feel free to comment below and follow me and on the channel here. Ask me questions. We'd like to interact with you anytime. Thank you for watching again.